there's a lot of problem which are beyond my control. So anyway, I am Dr. Saib Khalik. I think you've met me before. I'll be the clinical coordinator for year 5. And I do hope you enjoy the PITS posting. Things has gotten better since the last 2 years daripada zaman mula-mula pandemic. I think you all started year 3 masa you start clinical masa zaman pandemic mula lah kan. Dah. So I know that during that time your experience with especially pediatric probably wasn't that nice because there's no patient. There's no patient. It's very difficult for you to get into the ward. I always think that medical student, you should learn from the patient. You should not learn from your lectures, because lectures we have all the lectures recorded in YouTube. Almost, this is something that I don't agree. All those lectures are given by the same lecturer, and sometimes you only tweak a few of the slides. We are basically saying the same thing over and over again, which for me doesn't make sense lah. Kan, lectures you can always see the lectures in YouTube. You can always see. We have pediatric department YouTube. We have pediatric department Facebook page. You can view all the recordings there. It's nothing much different. But I think now we are going towards an endemicity. So I think you guys have more access to the hospital. You guys can have more access to the patient. We are having more cases. We do have interesting cases in the ward, and you do have access to HTA as well again. So I think that is gonna be good lah, because especially HTA, they have more interesting cases for you to actually learn from. Again, as I said, medical students, you should learn from patients. You should learn from patients, because knowledge, our lecture, you can get everything on YouTube. You can look at our slides. There's a lot of information. You can even when I did my masters, I always listen to podcasts. There's a lot of podcasts here you can listen. So those things you can get easily from everywhere. But what you cannot get is clinical experience. What you cannot get is actually clinical exposure, and you can only get that by going for clinical rotations. You be in the ward, you clerk patient, you examine patients. And I think that is the most important thing. So as best as you can, be in the ward, be with the patient. I always nampak students sometimes kan dalam ward, dah lah for some reason suspect now only limits. Kan sebelum tu lagi, sekarang ni dia belum change lagi. I'm hoping after the endemic now, they loosen up kan. Sebab sekarang ni you can only come to the ward when you have teaching with your lecturer. Kan, you can come like 2 hours earlier, and you cannot just come without any teaching. So that's, for me, that's a problem. I'm hoping they're gonna loosen up that ruling. So whenever you have time, come early to the ward, clerk patient, examine patient. You don't need to, and when you are in clinic as well, clerk patient, examine patient. The problem I see, students ramai dah lah susah nak datang hospital kan. It's not easy for you to come to the hospital kan. It's very difficult. You can only come when you have teaching. But even with all the difficulties, I always see students duduk dekat the sofa area. I always see students duduk dekat a seminar room kan. Before starting the teaching, go and clerk patient lah, go and examine patient, because that is how you learn. That's the only way how you can improve yourself. There's no other way. You can listen to so many lectures sampai muntah tengok My Face ke, Dr. Mossad ke, Datuk Fadil ke. You can look at them, mimpi-mimpi semua kan. But you will not be a good doctor. You can only be a good doctor if you spend time with your patient. That's it. Full stop. You can only be a good doctor if you spend time with your patient. You can only pass your exam If you actually go by the bedside, clerk patient, examine patient, that's the only way. And because lectures, for me, lectures ni kan, we should actually reduce lectures lah. But anyway, go and spend time with your patient. So now the wards are more open for you guys. You guys have more access. So please do. And inshallah, by next week, hopefully we'll have 2 more pediatrician joining us. So we'll have better lah, because now there's only 5 of us, and we are handling year 3, year 5 with the NICU, with everything. It's a bit overwhelming lah. It's a bit overwhelming. Jadi macam ni lah, lectures with me sometimes banyak nak kena tukar-tukar, sebab kalau baby tak okay, obviously my babies are more important than you guys. I'm sorry lah, but macam mana pun they are more important. And that's what I want to teach you all. Your patients are always more important. Your patients are always more important, because if you make mistake, if I delay for 1 minute, they're gonna die. I'm not gonna allow that to happen. So sometimes I think if we have more numbers of lecturers, hopefully we can plan things better lah. We can plan things better, because now with only 5 of us, it's a bit overwhelming. It's a bit stressful lah. So kadang-kadang kalau kena marah tu sebab lecturer tengah stress. So anyway, that's it. That's the I think I hope things are getting better. Okay, let me show the briefings. Okay. So year 5, if you remember in year 3 ni we focus more on like the basic things. We focus more on, if you've had teachings with me, I always emphasize more on like pathophysiology, all the basics, understanding of the disease. That's in year 3. Year 5 will focus more on management. We'll go more towards getting a proper diagnosis, proper differential diagnosis, and we'll focus more on management. And the thing is, you can never manage a patient well without understanding the pathophysiology. So I do recommend study back some of the pathophysiology, because if you understand the pathophysiology, you'll understand the presentation, you'll understand the investigation, and you'll know how to manage if you understand the pathophysiology. Again, I don't have much time, but I can offer again to you. I don't remember if I had the session with your group or not before when you were in year 3, but we can still have a session where we discuss about pathophysiology of common physical findings in pediatrics. Okay, so for year 5, what do we expect in the department? So there's several tasks lah, for you to go. The first one is the procedure seminar. Again, this is something that is not ideal juga lah, because previously what we do is students need to be in the ward, you observe procedures, you help, you assist procedures in the ward. But now because of pandemic, it has been very difficult for students to actually observe procedures being done or even practice doing procedures, because previously IUM students are known to be very good in terms of clinical procedures, because we allow them to do things when they were students. But now we cannot. We just simply cannot. It has been very difficult. Give me 1 second. Let me answer this. Okay. So, but the option that we have is actually procedure seminar. So where you present the procedures that are commonly done in the unit, and you present how it's being done, what's the purpose of it being done, what's the contraindication, what's the precaution that we need to take. So the objective is for you to learn and understand certain common and important medical procedure performed on the patient, either as diagnostic or therapeutic, or even both, such as lumbar puncture, intravenous catheterization, urinary catheterization, and so on and so forth. So and also even things like aero chamber. giving nebulization or aero chamber. MDI with aero chamber with spacer is very common question for exam. Very common. We always bring this up. Sometimes for man or ski, we bring one aero chamber. Man or ski and also unmanned or ski. Selalu datang. So we just bring one aero chamber. There's a patient there and you need to counsel. So usually for communication station. So you counsel how to use the aero chamber effectively and so forth. So things like this always come in. I mean, exam. Sometimes we even have for the communication station. We've had before patients. We have a scenario where there's a patient who's admitted for meningitis. So you are the house officer, then you need to counsel the parent to get lumbar puncture. So how for you to explain what is lumbar puncture, the indication, what's the problem, and so on. So what are the myths surrounding lumbar puncture? It's very common to come in exam. So that's why we think that with this, at least the procedure seminar, you'll have at least a bit of exposure on the common procedures. So learning outcome is for you to recognize and familiarize with the procedures that were performed by MOs, comprehend the indication and contraindication, able to identify the complication of the procedure, techniques of the procedure, and to explain how the procedure is actually being done. So these are the procedures that we expect you guys to discuss. Arterial blood gas, venous blood gas, capillary blood gas, central venous line insertion, urine culture and sensitivity, ECG, bone marrow aspiration and fine biopsy, and then CPR in children and CPR in infants. So not that many, not that many. So how it's gonna go? So basically, there's the session for each presentation. It should consist of 3 parts. So part A, where you present the slides. Each student present 1 medical procedure. Should not take more than 10 minutes. Should not be more than 10 slides. So it should be concise. It should be straightforward. Tak payah mukadimah panjang-panjang, tazkirah dulu, no. There's no need for that. So it should comprise of the introduction, indication, complication, list of equipment use, methodology, and you should have a video presentation of how it's being done. And then and part C is you try and observe the procedure being done by the medical officer or specialist in the ward. If you have the opportunity to go and observe lah. So after each presentation, we'll give the marks accordingly. This is how the marks is going to be given. And then, okay, next is case-based seminar. So case-based seminar is basically to look at your problem-solving capability, problem-solving capability. So recognize common chief complaint or common reasons to visit, identify proper and important relevant history, elicit important signs and symptoms, understand the process of making diagnosis based on different complaints, based on different problems, understand the basic management of important problems. So these are the case-based that you need to go through for the case-based seminar. Sinus, jaundice, pale, shortness of breath, wheezing, stridor, fitting, headache, altered sensorium, abnormal gait, lower limb weakness, diarrhea, constipated, blah, blah, blah. So these are all the lists. We'll give you the list. Sister Farah will give you the list again. So hopefully you'll go through and plan that with the lecturer involved. So each student will present 1 case-based session, and each presentation shouldn't be more than 20 minutes with 5 minutes discussion. There should not be more than 15 slides. And you are not allowed to actually cut and paste. You're not actually allowed to cut and paste. The lecturers usually will get. We want to have a copy of your presentation, so that we'll make sure that it's not an exact copy of the previous groups. Usually we can spot it easily. And copy and pasting, plagiarizing is actually a reason for you to not actually proceed. Okay, so assessment is as given before. Okay, next is problem-based seminar. The students will be given a topic. They are expected to discuss among themselves about the topic and prepare a presentation of the topic. So one topic you share among your group. So you divide lah. Siapa discuss pasal apa, siapa discuss pasal apa, siapa discuss pasal apa. So someone may discuss about the statistics of epidemiology, someone may discuss about pathophysiology, someone may discuss about the presentation, someone may discuss about the complication, about the management, and so on and so forth, social aspect, and so on and so forth. So you need to work as a group and then present as the most creative and logical ways. What are the topics? So these are the only topics that you'll be discussing: autism, speech delay, dyslexia, Down syndrome, learning disability, picky eater, short stature, ADHD, and delayed puberty. So students will be divided into group of 4 or 5. They will be given a lecturer, usually will be your mentor, and topic will be given to each group. Sometimes you can actually choose, or you can discuss with your mentor which topic do you want, and then they'll prepare and then present lah. So these are the weightage and the rubric for the markings. Next, case summaries. So case summaries you need to submit lah, macam masa year 3 sama je, macam ada department as well. So case summaries must be submitted 2 weeks before your exam. So ideally you should select interesting case lah. Janganlah ambil case macam pharyngitis ke apa, melampau lah kan. Pharyngitis, URTI, boring betul kan. Eczema, unless kalau uncontrolled eczema, fine, then that's interesting. So look for chronic interesting cases which have lots of discussion, which can show your maturity in actually discussing, rather than simple febrile seizure, URTI. Those are not interesting cases. So neonatal case also is allowed, but you need to discuss with neonatologist lah, me or Dr. Mossad. So learning outcome, we expect you to be able to study the case in and assess the case in holistic manner. It's a full, not just one element. And then write the case in concise and precise manner. We don't want you to go too long. So you should have the particulars of the patient, introduction of the illness, not more than 300 words, summary of the history, summary of the physical findings, clinical diagnosis, investigation and discussion, and final diagnosis. Patient management, including the progress in the ward. This has to be integrated inside the patient. Quality of life, how it affects quality of life, and discussion of the illness. Discussion should not be more than 500 words. It should not be more than 500 words, because I've seen before students having discussion so long, and the longer it is, it doesn't actually help you much. It just tells us that you don't know the problem well enough for you to actually summarize. So these are the weightage and the rubric for the marking. Okay, all right. This is an example of a good case that we have actually published. You can do even like this. This is a good example. I've seen a few groups before. They did their case summary kan, macam how we publish lah. This is published actually. This is published, so you can do something like this as well. This is a very good example lah. This is a very good example that is published. So you can even do like this. Okay, let me share you another element. Let's see. Sorry. So this one. Oh, this one. Okay, so sorry. Okay, so this is the assessment of the case presentation, bedside teaching. So you will have sessions where you present cases, bedside teaching like before. So well, it depends on the lecturer as well. Some lecturer can allow like 2 or 3 case presentation per session. Some lecturer focuses on history and presentation. Some lecturer will focus on physical examination. So it depends. It depends. Like with me, session with me, usually it's only one case presentation, and we'll go for physical examination if we have time, inshallah. So this is this is the rubric and the weightage of all the presentation. So HOPI, physical examination, diagnosis, investigation, interpretation, and progress and discussion. So this is the weightage and the rubric for marking. These are all almost similar to what you'll see in exam as well. When you go for man or ski, when you go for modified long case, this is almost the same rubric of how we mark during your exam. Okay, clear tak? Clear? Faham? Boleh? So I do hope you enjoy. Nanti Sister Farah will give you the timetable, or you already have the timetable.
Yes, Doctor, we got it already.
Okay, so please do contact your lecturers early on, because although we do have your timetable, but because there's so many groups, year 3, year 5, and other kuliah also got us to give some sessions with their students. So no one of us remember when the lectures. You do need to remind us. Like me, ideally I prefer if you can tell me a bit earlier, yes, good. But most important is the one day before. So just text me and remind. If you can text me earlier 1 week, then I'll put in my calendar, and then just on the day, 1 day before or on the day, please remind your lecturers. I do hope most of the sessions can be done face to face, but many of us have problem to actually go to com. The problem is SASMAC still don't allow many groups, many large number of students at one time in the seminar rooms. So that's the problem. So that's why we still need to use com. The problem, if we go to com, sometimes like when I'm covering NICU, it's a bit dangerous for me to go to com and so on and so forth. So that's the problem. So sometimes we do still need to do online lectures like today. So that's the problem, but we'll see how it goes. And as we are all clinicians as well, you'll see that many of us still have to do lectures during after office hours or in the weekends. So that I'm sorry, I apologize early on, but sometimes we just no option. We'll try as best as we can to actually have all the sessions during office hour, so that you'll have the after hours for you, but sometimes it's just not possible. So we'll do whatever we can lah. We'll do whatever we can. And again, I personally, I would offer if you want to have the session again about pathophysiology, then we can have that session. Okay. Next, I'm going to go for the communication in pediatrics. You want to have a short break or boleh proceed je?
Boleh.
Boleh?
Boleh.
Boleh. Okay, alright. Wait, let me stop recording and restart.